Good morning. Thank you very much for joining us. This is the second of a two-part series which discusses the introduction of technology into a small school of nursing. When I first came to this school in 2011, we had chalkboards, we had projectors which we had to bring into the room, and we had screens that we had to bring down in order to present our content. My goal and my vision was to make this school one of the most technological advanced schools in the Northeast region. And that was one of my primary goals. Now, some of our objectives of this program. Upon completion of this webinar, the participant will discuss the decision-making process to determine the platform to use for electronic testing, list the important elements of an electronic testing platform, and 3, create a plan to incorporate electronic testing in a school of nursing. Some of the background, and as we all know as educators, that technology has taken on a much greater emphasis in the education arena. Students expect us to be technologically advanced. They expect us to have Wi-Fi. They expect certain things of the schools that they go to. We also, as teachers and as educators, we have to prepare students, especially in the nursing arena, and to be able to deal with technology and to incorporate technology into their practice. And this is the role of an educator today, and also of a professional nurse, because nurses have to be very comfortable with the technology that they use. So this is our journey, and we had to first bring technology into the school, incorporate it into the curriculum, and then use technology as an adjunct into our curriculum. I'd like to talk first of all a little bit about our parent organization. I am the director of Holy Name Medical Center School of Nursing. Our parent organization, Holy Name, has always been very enthusiastic about technology. What you see in this slide is what we call our Infotainment System, which the patients love, and it's very, very interesting. You see there's a telephone. Patients use this telephone in order to call home. But this system here also can be used for the internet. It can be used as a radio. It's a multi-purpose system that patients really, really enjoy using. So this is some of the things that, our patients use. I wanted us to also have this level of technology within our school, just to be akin with our parent organization. The medical center also has something that they call Wedges, and that is their intranet. In this intranet, we have an interdepartmental communication. You can reach pharmacy, you have practice management, you have programming, you have security, you have x-rays, but we also ask them to create an app for the School of Nursing. Now what you see there is our app. Within this app, we have multiple things. We have our attendance taking process, and we also have a virtual hospital that we use for simulation. But we wanted that app because we also wanted to be incorporated within the main frame and within the main intranet services that the medical center has. I had a few goals when I came into the school. I understood that we didn't have systems, so I wanted to build systems. We needed a learning management system. We needed a communication system. We needed something for attendance taking. When I spoke to my faculty, I found that the faculty were taking 20 minutes just to take attendance. That was a lot of time out of the course and out of course content. Our classes usually have 50 to 60, I would say, students in them. So taking attendance and have them raise their hand, I felt was something that we didn't need to do necessarily. So one of the things we put in, and we put in through that app, was an attendance taking system. And here you see one of our students taking attendance. Before each student comes into the classroom, they swipe in. So that was one thing that we felt was important to the school and to make the school run smoothly. We also wanted a way to track who goes in and out of certain areas and to heighten security within the school. So what we did is we put these swipes, so these almost attendance-taking monitors outside of the rooms, in certain rooms, certain sensitive areas like our library, and because we also wanted to decrease the loss of library books. Students wanted the library open for 24 hours. We couldn't do it because we had no way to secure that area. Now with this system, we were able to secure that area. So what we did is we put in a swipe for the students so that they can go in and out. We know who's in the library. We know who's in what room. and we had a certain amount of security that added to the whole system. We also needed a means for our faculty to be able to get into WebHIS. WebHIS also has patient information. There were a couple of problems on the floors. We were starting and getting more and more computer-oriented as far as order entry and as far as documentation. It was very difficult for the faculty to be able to get to the computer system. So one of the things I did is I decided that, to get iPad minis for our faculty. A couple of reasons why we decided on minis, because of the portability. The faculty could put these iPad minis into their pockets and then yet be able to be very, very accessible to the students. Within the system and within WebHIS, the faculty can look up patient medications. They can look up patient information. And this way, they had everything right in their hands. So this was the faculty iPad initiative that we began. We also realized that we had no means of communication between the faculty and ourselves down here in the main offices. So when the faculty were in the clinical area, we could not get messages to them. We decided to use the iPad minis also as a means of communication. So that way, if there was a student who was absent or a student who was sick or something happened, I could send messages, or our front office people could send messages up to the faculty who were on the clinical units. We also wanted to put in some sort of means in order to deliver our curriculum, in order to deliver our classes. We settled on Smart Podium. What we liked about the Smart Podium, as you can see happens here in this slide, the faculty member can make notes right on top of the slide. We can save that information and then deliver it to the students too by posting it again. I'm posting it on Blackboard. We brought in a learning management system, Blackboard Pro Sites, and that has proven to be very, very effective for communication with our students. Where we went from where we had nothing to where we had the system where we could communicate with our students any changes, where they could get their syllabi, where they could see the PowerPoints, where we could have a good, strong means of communicating with our students, and it really helped us in that manner. And here you see our students in one of our classrooms, and again, the faculty member was drawing on, she was putting information there on the PowerPoint, and the students were able to get that information after class. So again, with the iPads that we gave the faculty, they were able to use that in the clinical area. So here we have faculty who are sharing information within the clinical area, and it gives our students hands-on and immediate information, right in their hands. So this eased that burden for our faculty also. And this is in the simulation lab. They could also print, they can also pull up in the app that we created and in the virtual hospital information on their simulated patients. So that way they have the patient's labs right there. They have their medications right there. So the simulation became more lifelike in what they would be doing on the floor. So we thought that this was really an adjunct to the faculty working with the students in both the simulation area and in the clinical area. And there again, you see the WebHIS information and access to the intranet. So we were able to get that access for students in an immediate manner. Then we moved on. After we went past this point, students started to ask us some questions. They wanted to know why our testing was not more similar to what they saw in NCLEX. As we all know, that NCLEX, the Nursing National Council License Exam, has been computerized and electronic since 1994. We were a little bit slow to this model. Students wanted to know why what they were doing wasn't more similar to NCLEX. The first time that they were being introduced to computerized testing was in this NCLEX RN examination. They wanted to know why our questions did not mirror some of the NCLEX questions, and our test environment did not mirror it. They felt that if we were able to do this, they'd be much, much less anxious when they sat for these licensing examinations. Some of the other issues that we had, because at this point in time, we were using Scantron. For each Scantron testing, we had to print 40 to 60 examinations. Once the examinations were complete, we threw them out. So essentially, we were wasting a lot of paper, and this was, of course, concerning. We were spending a lot of time scoring and rescoring examinations. In our school, we have the RN program and we have the LPN program. Now, in the RN program alone, I have two levels. I have my freshman level and I have my senior level. There were many times where all three levels were testing at the same time. So we had a lineup trying to get into the Scantron room in order to scan these exams. Then, if there was a question that we decided to take or to rescore, they had to wait again, and this was just taking up too much of our time. With test blueprinting, we were unable to create the level of a test blueprint that we wanted with the Scantron. And we could not track and really look at our questions when we revised them. So this was also something that we wanted to do. So we decided that it was time to start to move to electronic testing. Now this, of course, is not an easy project. It took us 2 years of looking into what we wanted to do and what we wanted as a testing platform. Now some of the reasons that programs do move is because they want to increase student comfort with electronic testing. They want to increase test security. They want, again, the ability to mirror the National Council Licensing Examination and their question formats. Students receive their scores instantly when you use this type of a format. We wanted to decrease the use of paper. We wanted the faculty to spend less time scoring exams, and we wanted it to be easier to adjust scoring. And we wanted to simulate the NCLEX testing environment. Some of our major priorities were we wanted to create NCLEX type questions. When we were using Scantron, we really had the ability only to create two types of questions, and that would be select all that apply and multiple choice questions. And that just was not enough to give students the real feel for what they were experiencing in testing. Again, we wanted detail in our item analysis. With test security, we were hearing that people were starting to cheat, and we wanted to try to allay that. And we also wanted more information for accreditation and for program information. So we wanted more actionable information. So we really wanted to get this, for our program. So, ability to create NCLEX questions. The NCLEX actually has multiple types of questions, and that, again, is what we wanted. They have multiple choice, multiple response, order response questions, and we did not have the ability to create any of this. They have hotspot questions. They have fill-in-the-blank questions. They have chart exhibit items. They have graphic items. They have audio items. None of this did we have the ability to create for our students. So we wanted, again, a system that would allow us to do this. We wanted a detailed item analysis. Some of the things that we wanted was the mean, the median, the mode, in order to tell us about exam difficulty. We wanted to be able to get the KR20 to tell us about the reliability of our exams. We wanted the point by serial correlation coefficient, which would differentiate our high-performing students from our low-performing students. And we also wanted the p-value, and this would tell us about item difficulty. Again, we did have this with Scantron. Hence, we had a bit of reluctance to move away from our Scantron. However, we knew that the Scantron at this point in time didn't give us all the things that we needed and all the things that our students needed in order to have a good testing experience. So this was, again, a concern of ours. We wanted more student performance analysis. We wanted our students to be able to know how they did almost immediately. We wanted our students to have information about their performance, to know where their strengths and their weaknesses were. Our current system did not afford us this ability. We wanted to be able to assess our students on learning outcomes, predetermined learning outcomes. So we wanted to be able to share with our students when our advisors met with them in a one-on-one meeting about how they were doing. We wanted to be able to, again, identify student strengths and areas in need of improvement. So again, when the advisors met with the students, we would be able to really focus on areas of improvement and give them actionable information about what they needed to do better in our nursing course. As we all know, and as you may not be aware of, nursing has a very, very high attrition rate. Usually it's about 10 to 20%. Ours was hovering about close to 20%. I really wanted to bring that attrition rate down. I wanted to be able to assist our students to be successful and to, again, have more students be able to go successfully through the program, and yet have nurses come out of the program who would be high achievers within the nursing community. Again, test security. We were very concerned about test security. So whatever program, whatever we decided that we were going to use, we wanted to be sure that the camera was disabled, that the browser was disabled, that there was no internet access during exams, that there was an inability for the student to leave the test environment, because, you know, students can be pretty inventive. So we didn't want the student going on the internet and finding answers and trying to find out information. So we really wanted to be able to halt that. We wanted capacity to track the students' keystrokes to make sure that there wasn't anything funky going on during the testing experience. So we really wanted to heighten our test security. We were getting reports of cheating. Students would come to us and say that there were students cheating. Of course, students don't want to report on other students. So we wanted to shut that down as much as possible and to get that out of the way. So we really wanted to heighten our test security. As far as test blueprinting, we needed a better test blueprint. We really wanted to be able to have our objectives in there, to have more taxonomy, to look at the nursing process, to look at quality, safety, and education in nursing, CUSA, because these are some of the mandates that we have as, as educators in nursing education. We wanted to be able to bring in more of the NCLEX test blueprint and to see how we were scoring. We wanted more information about our program so that we could really make sure that our curriculum was achieving what we wanted our curriculum to achieve. So these are the things that we were looking for in a testing program. So we had to go through the decision-making process. And again, this turned out to be a 2-year process for us because we really wanted to investigate everything before we moved away from Scantron. So we looked at the learning management system platform. Again, we had Blackboard. Within Blackboard, there was a testing platform. There was a Scantron-based platform that we looked at, and there was a server-based platform that we looked at. So we decided to weigh our pros and cons. When we looked at the learning management system platform that was within Blackboard, it had a lot of pros to it. First of all, of course, no extra cost. We already had the program. It did score our exams immediately, so it gave the student immediate notice of how they were doing. It was really easy to score and rescore the exams. There were multiple choice question formats that we could use. We were able to link our revised questions and trace the performance of our students, which was really good. It was very easy to add extra time when students needed extra time on exams. We were able to align our questions with our learning objectives, and again, it was server-based. Our medical center was very concerned about putting anything on hospital servers because, again, if this were to be pulling too much, you never know how it might affect the hospital servers. So, again, they did not want anything that we had to put on the hospital servers. We wanted something that would be based on a server outside of the hospital server. Now, some of the cons of the learning management system platform was the item analysis did not give us the detail that we wanted. There was no KR20 and there was no point by serial. The information that they gave students as far as analysis, it was not as detailed as we might like. And there was a limitation again on test blueprinting. So that made us, we weren't too happy with that. So we looked at the Scantron-based system. This was, again, very affordable. The price was right. It would not cost us very much. It could be done by paper and pen, or it could be done online. Again, there was an immediate availability of the students, so the students could immediately see how they were doing. There was no licensing, so there was no limitation on how many students took this exam. So we didn't have to worry about having a per-student license. We would just get this software, and that was it. There was a detailed item analysis. It gave us the item analysis that we were used to. So we thought this might be a pretty good thing. Now, here was the problem. It would have to be installed on the server. There was not a launch date on this, so we didn't know when this was going to begin. There was a limited student performance analysis, and we weren't able to analyze the program performance. So we weren't quite happy about this. Again, we didn't have a launch date. It was still in the planning stages, so we couldn't even speak to anyone to find out how they liked it, what was some of their missteps, what could they do to be able to, to ease our transition to it. So it had a few more cons than we were comfortable with. Then we looked at a server-based software, and that was through ATI. Now, what we liked, again, is it was server-based. We did get a detailed student performance analysis. However, the question format was a bit limited. The item analysis didn't give us the flexibility or give us the information that we wanted. There was a limited program analysis, and there was an inability to trend data for accreditation basis. So we felt that this was a bit limited. So moving forward, we decided, we really, really had to make a decision. We really needed to decide what we were going to use and how we were going to use it. So we decided on using the platform based within Blackboard. One of the things we wanted to do, again, as I explained, we have a small LPN program here. So we wanted to trial this on a limited basis. So we started with our LPN program. And we started with our smaller program, because within our LPN program, we have our LPN day and our LPN evening program. So we decided to start with the LPN evening program, then move to our LPN day program with testing within Blackboard. And we did this for about 6 months to a year, and we found much success with it. So we said, okay, despite the limitations, we thought it would be best to move to this program. So our decision was to go with the LMS, with our Blackboard testing platform, and that was where we were moving. Well, we changed our mind, which often happens, as we all know. I went to a conference. I went to the National League of Nursing Technology Conference. I presented at that conference part one of our, of technology and of our, our integration of technology into the school. I spoke to a lot of people, and actually there was a Podium presentation where they talked about electronic testing. And one of the things they talked about was ExamSoft. And they talked about how happy they were with the use of ExamSoft. So, and then there were a lot of schools who were talking about ExamSoft. And they told us that there was detailed information that you could get from this, that there was a high level of security, that the analysis was detailed, that we can get program analysis, student analysis, item analysis, analysis that we could give to accreditation. There was item banking with historical information, and there was a high level of test security. So, of course, when I came back to the school, I brought this information back to the faculty. We had a testing committee, and what I asked is for the testing committee to look into this new solution, ExamSoft, and to compare it to what we were going to do. What the faculty did is they looked into it. We had webinars, and they made a comparison. And then, of course, we changed our mind. We decided to go with ExamSoft because it gave us most of what we were looking for in an exam package. And we felt that this was an investment in our time as far as training and as far as the students' time and money, of course. So we wanted to give them the best package that we could give it, and something that gave us a lot of comfort. We knew that there was going to be a high amount of work and a lot of details that we'd have to go over. But we felt, again, that this was the package that we would most be satisfied with. So we decided to go with ExamSoft. With that decision, we had to do a whole lot of planning for electronic testing. One of the first things we had to do was decide whether we were going to use laptops, Chromebooks, or iPads. Again, we knew with all of this came a learning curve. We wanted to make sure whatever we decided to use, that there would be a compatibility with the applications that we presently use. We wanted something that had a good price in it, and we wanted something that had a high level of usefulness. So what we decided to do is we had IT bring in Chromebooks, and we trialed the Chromebooks to see how we liked them. Now, the Chromebooks were pretty good. They worked really, really well. However, compatibility became an issue. They weren't compatible with some of the platforms that we use currently and some of the platforms that supported our curriculum. So we had to rule out the Chromebooks. We also wanted to be able to lock down whatever device that we decided to use. And with the Chromebooks, there was a limited ability to lock down the Chromebooks while the students were in school. So then we looked at regular laptops, and we thought about purchasing some sort of software that would allow us to control them. Well, the biggest problem with the laptops was the price. Laptops cost a lot of money. And then again, the involvement with IT would have to be very, very large. Now, our IT also works with the medical center, and we just didn't know we could put that much of a burden on them with regular laptops. So we looked at iPads. We did a survey with our students, and we asked them what they would like. In the survey, we put laptops, Chromebooks, and iPads. And with the iPads, we asked them if they would like to use iPad minis or the regular size iPads. Well, I was very surprised, quite frankly, as the outcome. I thought if they wanted iPads, they would want the big iPads. No, but our students wanted the minis. They felt that the minis they could put in their pockets, they could bring it to the clinical area, and they could get most out of the minis. The price, of course, was right with the minis, and the usefulness was right. It also was very, very compatible with our current software. So we decided to move with the iPad minis. It solved all of the things that we wanted. It was the portability, the utility, the compatibility, and the cost effectiveness. Even though we were going to put on our iPad minis an app that controlled the minis, it still came in at a very, very good price for us. So we decided just to move forward with using our iPad minis. And that was our choice, and that's what we went with. So we had to start to plan sorry about that. We had to start to plan for electronic testing. What we decided to do is we had this faculty testing committee. So we wanted to have that committee become our steering committee. So they had certain things that they had to work on for us. They had to determine policy. How are we going to orient the students? How are we going to orient the faculty? How are we going to develop our exams? How are we going to administer our exams? We wanted a standardized test blueprint. We wanted the same blueprint for the LPN program and for the RN program. So that way, as students move, a lot of our students move from the LPN program to the RN program. So as students move from one program to another, they knew exactly what we were testing, exactly what information we were trying to get from our exams. So we also wanted that standardized test blueprint. We wanted to determine also an approach to item writing. We wanted to make sure that the items within our exams were consistent and that there was no doubt on the items, and that there would be less back and forth with the students. So we also wanted to make sure that the remediation was looked at in the same way. So there could be no playing faculty off against each other. So we wanted everything as consistent and as standardized as possible. We also wanted to determine a question approval process, because one of the things is that we get so married to our questions that when other people come in and critique our questions, there can be a little bit of a concern there. So we wanted to have a standardized way that questions were approved before they actually went into the item bank, before they actually went on the exam. So that was another thing that our electronic testing, our faculty testing committee had to do. So they had all of these things that were part of their goals. So we instituted a few policies. We did not have a standardized policy as a student to faculty ratio as far as testing goes. So in a classroom of 60 people, we might have only 2 or 3 people who were there monitoring the exam. Because of the incidents and the complaints of cheating, we felt that we had to do a lot more in that manner. So what we decided to do is to institute a 1 to 25 student testing policy. And the reason why we went to 25 is because in our LPN program, we might have 25, 30 students. So that way we could ensure that there would be 2 people in that classroom, 1 in the front and 1 in the back. We already had certain policies that we had, but however, we had to ask ourselves, do we really follow through on a lot of our policies? And we decided that we had to, first of all, make sure that our policies were followed through on and that we were consistent in our policies. One of our things that we had in the policy was that when students come into the classroom, everything goes to the front of the room. They are not to have their phone, they're not to have their book bag, they're not to have their pens, they're not to have their pencils, nothing. They're to sit there at the test with only their iPad, and that was it. We provide scrap paper. I also created a czar of cheating. So it was her job to look at everything that students do in order to cheat so that we could sort of, combat this. One of the things she found was scrap paper, even allowing students to bring in scrap paper. Now, you and I know, most scrap paper, we pull out white paper, we hand it to all the students. In some schools, one of the things that she found was that students bring their own scrap paper. In other words, they switch scrap paper. So the scrap paper might have answers on it. So what we decided to do is not only do we collect scrap paper after each exam, we color-coded the scrap paper. So in other words, for today's exam, the code of the day might be pink scrap paper, and the students would not know what color scrap paper we were bringing to each exam. So that was one of the things that we did, and we found a great amount of success. Now, the students do put their name on the scrap paper, and we do collect it after the exam. And again, they have no idea what color that we're going to bring in. We provide pencils for them. With ExamSoft, another thing that's nice is there's no calculators needed. The bathroom breaks, that was an area of contention. Do we allow bathroom breaks during an exam? We do not. They have to go either before or they have to go after. We felt that for a 60-item test, that if they went before the exam, it would be much preferable, or if they went after, they should be able to wait until after the exam. Another thing that we had, again, in our old policy that we didn't really enforce, was that we seat the students for the exams. In other words, all of our class waits outside till we let them into the room, and then we seat them into the exam room. They can't just sit where they want to sit. We decide, okay, you sit there, and we leave at least 2 spaces between the students for the exam. We also decided on having a different password to resume the exams. So in other words, should we have to stop an exam, we have a different resume password. So that was something else that we decided. We did do other things as far as our exams, as far as the item analysis and that type of a thing. We also, because we wanted to make sure whatever we released to students was really standardized. We wanted to make sure that the conversations, I don't want to say that they are standardized, but that students were getting the same information. So we decided to approach the remediation also in a standard manner. All of the remediation that the students do immediately after the exam has citations to it. So that way the student knows where to go to get that information. So that was another thing that we did, and that goes across the levels. That goes from our freshmen, our senior RN levels, our evening LPN program, and our day LPN program. Everything must be consistent. We created that pairs of faculty. So if I'm creating an exam, and this is my exam, and I have 10 questions on this, if you're my buddy, you will be looking at my questions and you will be critiquing them. What we ask is that you critique them honestly. So if there's things that you feel that I need to change, that the language needs to be changed, that you tell me that, and that I do this. So that was another thing that we decided would be extremely necessary. And we have found much success with that. We find that our questions are less bundled with words. They're more to the point. They're clearer for students, and our students are much, much happier about not taking our exams, I should say, but they're much, much happier about the consistency in our practices. Now, I won't tell you that we're still not a work in progress. We still are working on many, many issues, of course, with the exam process, and we're still learning, and we're still sharing our information. We still meet once a month. Our ExamSoft testing team still meets routinely to find out what the problems are. Are students satisfied with the information that we're releasing to them? How are they viewing the exam? So we still are working on many, many things and many issues in order to smooth out the process. Our orientation, we looked at our orientation. We're thinking of creating a packet for students and for faculty to go along with the ExamSoft webinars, because we felt that we needed an ExamSoft cheat sheet, so to speak, so that we can have in there some things that we found to be successful, and that we could pass it along to our faculty, to assist them as they go through the process. And there I've given you a list of my references. And I'd like to thank you for attending. Are there any questions that I can answer?
Thank you so much, Dr. Blackwell, for sharing your expertise with us this morning. We do have a few questions. However, I would like to take this opportunity to remind everyone of our upcoming webinars. On the screen here, Wednesday, March 4th, building test committees that have authority to create effective change, and Thursday, March 12th, grading your assessments, how to evaluate the quality of your exams, both presented by Dr. Ainsley Nybert. We do have a few questions in our question panel. Please do feel free to share and post questions in the question panel, and we have several minutes. We may be able to get to them. The first question is, did you pilot ExamSoft before making your decision?
No, we did not pilot it for a couple of reasons. We had already piloted the Blackboard, their testing, and we really didn't want to have to burden the students again with a pilot. So we really just went full out. One of the things we did is we actually started in the spring before we brought out the whole system in the fall. So we did do a lot of work over the summer. Faculty went home, and what the faculty did is that each faculty member created an exam. And we practiced downloading the exams, taking the exams, that type of thing, because we wanted to be intimately aware and knowledgeable about the whole process of download, exam taking. We also worked over the summer on test questions and getting our test questions in. So we had a lot of things that we had already laid out within our timeline, and we felt the need to really push forth with using ExamSoft. Because one of the things that was happening with the former system is that it was crashing, we were losing information, and we just felt strongly about the system. And again, this was a 2-year process for us to make a decision, so we felt we were really ready. And this was the one system we felt that gave us everything that we wanted.
Excellent, thank you. The next question is, having implemented iPad for faculty, what type of resistance did you receive, and how did you go about preparing to use them, or rather preparing them to use this technology?
Oh, good question. Of course there was resistance. As you know, we're not digital natives, so we don't grow up with this, with this technology. So I did receive resistance. I still receive resistance. People aren't used to it. But as time is going on and they see the utility and the usefulness of having this iPad, it sort of has worked its way out. One of the things that we did is we sort of pushed that you have to use this iPad. We told faculty that you're not going to know who's out sick, you're not going to know who's not there, and you're not going to get any information unless you use that iPad when you're on the floor. So we kind of pushed that through. As far as orientation, we did an orientation here, of course, down here. And we just went through, actually I walked through the use of the iPad. I did it's not called a webinar, it's a, oh, I forgot what you call it. It was a web thing where they had to find certain things on the web using their iPad, which was fun. So that we did that also, so you could just get used to touching things and get used to using that iPad. And I have to say, it's much better. We also put the faculty's email on their iPad, so that way their email was right there. They have access to WebHIS. Now, again, only the faculty have access to what WebHIS, because as I told you, that has patient information. So we have some control of that. So we did do that. So that means that they, when they couldn't get a computer, they had to use it. So we've just tried to make it integral to what they do and, into a part of their lives. Now I have to say, when faculty come to faculty meeting, they bring their iPads, which is great because, again, I'm trying to decrease our use of paper. I hate printing out everything. So I can put the agenda on the iPad. We have what we call the director's report. I put that on their, on their iPad. I put it on Blackboard. They download it. They use it. It has to be a part of everything that they do. That's the only way that you're going to get buy-in to it. And that's what worked for us.
The next question is, did you also do a one-to-one iPad implementation with your students?
Yes, we did. What we did was What we did is we had the students in the class. Now, we have a huge freshman class. I mean, we had, I think it was 60, well, I guess it's not huge, 66 students. So what we did is when all the students had their iPads, we went through the full process, step by step. So we did this multiple times. We also sent the students many exams, fake exams, just to download and just to play with, just to do, just to upload. Well, we had a few, of course, kinks in the process. And sometimes students were leaving the room without uploading their exams. So we smoothed out that process of it. Before a student leaves the room, we have to make sure that the exam has been uploaded. We have to make sure that we see that success panel there. I mean, it was a detailed process. Again, we've given the students cheat sheets to work through. Of course, we found that we have some students who are a little bit slower than others. We buddied students up. Students have the ability each day before, usually we give exams on Fridays, students have the ability to download fake exams over the weekend, just to practice. We wanted them to have a high level of comfort with downloading and uploading their exams and doing guided access. Usually during the exam at the beginning, all faculty are there. For instance, I have 6 to 7 freshman faculty, so we're all there, including myself, at the start of an exam, just to make sure that everybody is comfortable with the exam process. And what we found is that there's less and less time getting everybody in the same spot. We also have 5 loaners that we have, and we always have them in the room in case students are having problems with their iPads. Now, we went from having to hand out all 5 to the last exam, we don't hand out any on either level. So they've developed a real comfort with it. And remember, we just started in September, so I'm pretty proud of where we are at this point in time.
Thank you. The next question is, did you require students to purchase the iPad, or did you provide it to them? And if so, how did you manage the devices?
Good question. We provided it for them. One of the reasons why we provided the iPad for them is because we wanted control of that iPad when the student was in the school. We didn't want them surfing the net. We didn't want them going on Snapchat or whatever. We didn't want them Skyping in the middle of class. So we provided the iPads for them. What we have is a management, it's an app that manages the iPads. So in other words, when they're in the school, the only browser that will work is the browser that is through the system. So they have to use that browser, and that browser is locked down. So they can't go on certain things. And we've gotten, again, a lot of success with that. So the iPads are prepared by our IT department. So when we bought, I think it was 150 iPads, but we did do it in cycles for them. It goes first to, it goes first to the company that's working with us, because we did get a company to work with us, and they do everything for us. So once they come in, IT checks them, make sure everything is there, and then they bring them to us, and then we hand them out. So that has worked very well for us. It also keeps them, where we want them to be within the class time, and it keeps them from sort of wandering during class time. Now, the problem is still the telephones, of course. They have their little phones in their hands during class time. So, of course, they're still going to do certain things, but at least we have a certain amount of control over our iPads once they're in the school. And again, we purchased it for them. We did put the price of the iPad on their student bill, and the students do understand that this is their learning tool. We really, really focus them in on this is their tool, and it's to be used as a learning tool. When they're outside of the classroom, they can use it as they want to, but once they're in the classroom, this iPad is only used for the curriculum and for learning.
Thank you. Excellent. Did you have the students take the exams in the classroom, or did you utilize a testing center?
We use the classroom. Our testing center does not have enough room, and that's one of the reasons why we needed to either go to iPads, Chromebooks, or something, because there's just not enough space in there. We only have 48 computers, and usually our classes are upwards of 50. So we test right in the classroom. Again, we've initiated a 1:25 ratio. So usually in a class, we'll have about 4 faculty members walking around, just making sure that everything is, hunky-dory, so to speak. We don't allow water bottles. We don't allow pencils. We don't allow nothing. They have their piece of paper, the scrap paper that we give them. They have the pencil that we give them. We collect everything after the exam. Everything, their hats, everything is at the front of the room. So so we can feel fairly comfortable that the test is secure. And this is what's worked for us. So they tested our freshmen test in their freshman classroom, our seniors test in their classroom, LPNs test in their classroom. So we're quite happy with that.
Did you see a higher NCLEX passing rate by moving in the direction of ExamSoft?
We won't know until the end of this year. I can tell you one thing. We have seen better retention already going from one semester to the other. Now, we're not, quite sure. Again, statistically, we can't say. Again, this is a good study, and we probably will do a study on this. I think students get better information. They are far more satisfied. I was actually seeing in evaluations where students were saying, I don't know what to study. I don't know where my problems lie. You're getting actionable information. They can see immediately when they get a question wrong. They can see immediately where the information is for them to correct whatever it is that they did wrong or that they don't understand. So that when they come to sit with their advisor, it's for further clarification. It's to clear muddy points. It's not for, well, why did I get this wrong? That doesn't help. We really wanted the students to have something that they could hold on to and understand what they're doing wrong. And we found that the Strengths and Opportunity Reports does give us that, and the students seem to be pretty satisfied with them. Since we started with ExamSoft, we actually have modified that report twice. We're going to look at it again at the end of this next semester and see what the students say about it. What do they want on it? What aren't we giving to them? The one thing we don't give them is we don't give them the questions on that exam, because again, we have to have a high level of test security.
Can you briefly talk about the implementation process?
I don't know if I can do it briefly, but we did first of all, I created a timeline because I wanted to be able to make sure that we plan things out. So I created a timeline for planning, what we were going to do in the spring, what we were going to do over the summer, what we were going to do when we came in September. We decided how we were going to orient the students. But first, we also had to become comfortable with the platform, and that's how we decided how we were going to orient the students. What questions did we have? And that's how we sort of created our ExamSoft cheat sheet. What issues did we have? Were there problems with the guided access? How do you do guided access? So we looked at all of that with us first. And again, we started in the spring. We actually started in, I think it was March or April. And we wanted to get ourselves pretty clear on the process first. Again, over the summer, what we did is we had faculty become more comfortable with the process. So again, each faculty member, and I have 17 faculty members, created an exam. They sent it out to all 17 faculty members so we could practice taking the test, uploading the exam, looking at the results. What questions did we have? So that gave us a lot of data and a lot of information for when we came back, because my faculty comes back in August. So we were able to really sit down in August, hone in on how we were going to plan, how we were going to orient our students, and plan how we were going to orient our students. So that helped a lot. One thing that I also would like to share with you, as far as our questions and making sure that our questions were as concise and as complete as possible, we did bring in an expert. I wanted everybody to be on the same page as far as item analysis and question writing and item writing. So we brought in somebody in May in order to work with us. What was good about this process is that we actually brought our own questions that we used and that we've used in previous exams. So we could see where we were wrong and we could see how we could better write questions. Because we wanted anything that went into ExamSoft to be almost pure, to have a good beginning, a good, strong beginning. So we did that before we really started entering questions into the system. So our project over the summer was entering questions, approving questions. So if I was working with somebody, I would send them 20 questions for test number 1. They would look at my 20 questions, and they would say, okay, you need to do this, you need to take this, your grammar's not right, you got a typo here. So that way we'd have things coming in that would be much cleaner for the students. And that's what worked for us. But I think developing a timeline, trying to stick with the timeline, knowing when you want to start, ironing out your problems with your own faculty yourself, and really writing down those problems. We met over the summer virtually to talk about some of the things that we found, and that really worked well for us.
Thank you. How has the implementation of the ExamSoft platform affected your culture of assessment, and how have you used the data to affect program improvement?
I have to say it really, really has. I mean, we have really created a culture of assessment. I think before the exam and the test was all important, now we're beginning to see that it's not just about the exam. We're seeing that there's so much more that goes into it. We look at how our students do in certain areas. For instance, what we found is that application is a big, big weakness with our students. So now what we're emphasizing through case studies and in other areas is we're emphasizing application. We found that they have issues with the nursing process as far as planning. So what we're doing now is that, again, in our case studies or in other modalities within our classroom teaching, we are adjusting that teaching to emphasize these areas. So we have used the data from ExamSoft, I think, to make the program better and to help students understand that it's not just about the test. It truly is about the learning process, and that the test is assessment of knowledge acquisition. And if the student doesn't do well, then we don't do well. So we have let students know that although they get at the end of the exam this number or this percentage as to how they've done, that's not the final piece of it. We look at every single question in a detailed manner, and we may decide this question wasn't clear. We need to make this question better. This area isn't clear. We need to do better about that, So that might not be their final grade. We have, and it's written into our policy, 48 hours to post final grades. So what you see at the end of the exam is a preliminary grade, because we have to go over our items. We have to look at the reliability. We have to look at the difficulty of the questions, and we have to make a decision based upon that data. Was the question a good question, essentially? And it has really, really helped us hone in on that. And I think it's made the exams better, quite frankly. Also, as far as long-term analysis, once we get more data, because again, we've only been using it since September, we're going to really, really look at the data and see what we need to do as far as curriculum. And that's going to take us a little while in order to get data that we can use.
Thank you so much, Dr. Blackwell. Do you have any closing comments?
No, I think, again, it's a learning curve. I think for us, it's been a good experience. I think we are developing, we're changing. I think one of the things that are really, really important is to have an involved testing committee. What I did is I had the central testing committee, but I also had testing committees on each level. We had the freshman, we had the senior level, and we had the LPNs, because each level has distinct issues. So it's very, very important to have representation from each level to look at the issues that each level may have. And I think that that's what helped us to, knock wood so far, be very successful and to have a good experience.
Excellent. Thank you so much, Dr. Blackwell, for sharing your time and expertise with us this morning. Thank you, everyone, for attending our webinar today. We appreciate you taking the time out of your morning to learn more about the implementation of technology into a program. We would like to remind everyone that at the conclusion of the webinar, you will receive an opportunity to participate in the 7-question survey. Completing this survey helps us continue to provide relevant content in all future presentations. Dr. Blackwell, thank you again so much. This concludes today's presentation, and we look forward to seeing you all again in the future.
Thank you.